Okay, so the first thing I would do when I come into a patient's room is wash my hands and identify myself. Hello, my name is Jamie and I'm a Hack nursing student. Then I would go over I would close the door for privacy and then go over the procedure. Today I'm going to change your dry sterile dressing. Is that okay? Okay, and then I would get my MAR to confirm that I have the right patient. I would check for the name and date of birth while comparing the wristband, and then I would also ask if they have any allergies. Once I do all that, my first 5, I'm going to ask the patient if they have any pain, if there's any itching or anything that's that's happened since the last time we've changed the dressing. And then once they say that, I can go to get my doctor's order and I can confirm my doctor's order. So I see you have ordered to have your sterile dressing changed every 24 hours, and it was last changed 24 hours ago. Okay, now that all that's done, I can work first by donning some clean gloves, and I'm going to work to remove my old dressing and put my new dressing in. So my patient's head is this way, and then this is the back of the head, and then this is the tray table. So pull the skin down, and you go up all around. Careful not to compromise skin integrity. Okay. Now that I'm gonna make sure to pick this up away from my patient in case there's any drainage or anything, or any odor or anything. You don't want the patient to get a whiff of that. And I'm touching these 4x4s. That's just because it's on paper and it's hard. It keeps getting stuck to the tape, but I understand that I wouldn't touch these. These would stay on here. Okay, so I picked up my ABD, and now I'm going to assess my ABD. So first I'm gonna assess my ABD. The color is purulent. It's of a thick consistency. It has no odor, and it's covering about 50% of the ABD. Okay, now I can throw that away. And I'm going to now pick up my 2 4x4s and do the same assessment. I'm going to. Again, doing the same process, making sure that I pick it up in such a way so that the patient doesn't get a whiff of it if it's odor, and then so that the patient doesn't see it. So for my 2 4x4s, I'm gonna assess them. It has, again, a purulent color. There's no odor on either pad. It's a thick consistency, and this time the purulent drainage is covering about 100% of each 4x4 pad. Okay, now that that's done, I can work to assess my incision using Rita. So I'm seeing that there is redness surrounding the incision. It's not a well approximated incision, so the redness is kind of focused where it's not where there's sutures missing, and then it's all around too. There is some swelling where the missing suture is suture number 3, which is missing. I'm seeing some swelling there. And then, like I said, this suture is not well approximated. So I'll count proximally to distally to see how many sutures are missing. I have 1, 2, 3, 4, 5, 6, 7 sutures intact, although suture number 3 is missing. And I'm also seeing some ecchymosis laterally, proximally laterally. You see some spots of ecchymosis that are forming, so I'll be sure to note that in my documentation. Okay, now that I've done that, I can doff my clean gloves and wash my hands, and now I can work to set up my sterile field. To set up my sterile field, I'm going to wipe down the patient's tray table, which is what I'm using, because there's a whole bunch of germs and everything, because the patient uses that. So since it's going to be a sterile procedure, I'm going to wipe that down, clean it, and then I'm going to work to set up my sterile field. So I have my gloves, ABD, my 2 4x4s, tape, and my swab sticks. Okay, so the first thing I'm gonna open is my ABD. Okay, let's open. And now that's open. So, and I will be working with this all at waist height because it will be out of my sterile field if it wasn't at waist height, but my table unfortunately is not. So what I'm going to do is this. To get my tape. Okay, so unfortunately my packets, I opened both of my packets, so they're already open. But now I would work to open this packet. So I would very carefully tear from one side, tear from the other side, twist and pull up and throw in the garbage. Then I would push my swab sticks up so that I don't risk contamination when I you take them out with my gloves on. And again, this would all be at waist height, and so would my patient. Okay, now I can work to put on my sterile gloves. Okay, and now I'm using my hitchhiker's thumb. Okay, now my sterile gloves are on. So the first thing I'm gonna do, I'm going to clean my incision. So I'm going to grab a swab stick, making sure to hold down so that none of the liquid drips back onto my gloves. And I'm going to right down the middle, clean, and drop. And then the side furthest from me, and drop. The side closest to me, and drop. Okay, now that I have my incisions cleaned with my swab sticks, I'm going to put my 2 4x4s on. So, and another thing too, I want to make sure that I verbalize. So when my sterile field is set up, it should be set up in a way so that I don't have to completely turn my back to the patient, because then I would be out of sterile field. I would be breaking sterile field. So I just wanted to verbalize that, but it's a little hard to show with the way my table is since it's curved. Okay, Now I'm gonna work to put on my 4x4s. Okay, now my two 4x4s are on. Okay. Okay. Now my ABD pad is on. So I'm going to take off my gloves, as you can see, grasping at the middle. And that is in the garbage. So from here, I can choose to wash my hands again, and now I'm gonna work to tape up my Band-Aid, my ABD, sorry. I'm not pressing down hard on it, I just wanna make sure it's smooth. Okay, now that, let me just, okay, now that it's smooth and the two 4x4s are covered, I can now tape using the window tape method. Okay. My tape goes half on and then half off. Okay. Okay. Then I'm gonna get another little piece of tape. And I'm going to put the date, my initials, and the time. Okay, so I put my label, I did my window tape method, I can throw away all this, wash my hands, lower the patient's bed, and document.